The following is an example of a 90837 Utilization Audit letter. Quote, Regents Blue Cross Blue Shield of Oregon contracted with Change Healthcare to implement the Coding Advisor Program in order to review the use of psychotherapy codes. As part of this partnership, we have analyzed claim data between July 2020 and June 2021 for the purpose of identifying providers who are billing high-level codes significantly more often than other providers within the same specialty. As demonstrated in the attached report, your billing of these services is considerably greater than the expected billing distribution of your specialty group. It is important that your practice understands and abides by the applicable documentation and reporting guidelines to ensure that the medical records support the services provided. The Change Healthcare Coding Advisor Program is intended to be informative in nature and is not intended to question a provider's treatment methods or clinical judgment. End quote. Change Healthcare goes on to state the following under the heading, Continuous Monitoring. Quote, Change Healthcare will continue to review your billing trends. We will periodically send you updated reports pertaining to how the quarterly review of your claim activity compares to other providers within your specialty, and will share these results with Regents Blue Cross Blue Shield of Oregon. If subsequent analysis reveals that the proportion of reported high-level codes continues to exceed the expected distribution, Change Healthcare may contact your practice for the purpose of further validation and education. End quote. The bar graph in this utilization audit raises many concerns. One concern is that this letter is a prelude to more letters comparing one psychotherapist to a group of psychotherapists. Another concern is the lack of transparency. There is not enough information about the reliability and validity of the graph to challenge the assertion. For example, the graph does not display how many providers use 90837 to the same degree. Also, the comparison creates a pressure for a regression to the mean. The 90837 utilization audits are specific to a face-to-face CPT code for a psychotherapy session lasting 53 minutes or more. In our view, these are politely coercive and disingenuous letters telling psychotherapists that they are using a CPT code more than a reference group. Upon receiving such a letter, psychotherapists should review their charts to ensure that their documentation is complete as to 1. The diagnosis is appropriate. 2. There is a problems and symptom list. 3. There is a documented reason for the extended session code during those appointments. 4. There is an individualized treatment plan. 5. The medical necessity for care is documented. 6. The psychotherapist has including appropriate information requested in the payer's policies. And 7. Start and stop times, or the start time and the amount of time. There will always be psychotherapists who use a 90837 more than others, because patients are not the same. Letters like these pressure psychotherapists to reduce utilization or to game the system. Think about it. Health plans never sponsor or provide resources to help you become more effective. And they don't send letters about how much less you are charging than your peers for the same services. They don't care if you really need to spend more time with some patients. And frankly, this letter is intimidating. What else can you do if you receive a utilization audit letter? A 90837 is an extended session. It is not an entirely different service. There are usually treatment reasons and unforeseen problems that surface during sessions that result in a 90837. For example, some patients need stabilization. Others require a plan until the next appointment. We found 35 reasons that can justify a 90837. You will learn more about these when you start using the Grid Learn While You Chart software. Psychotherapists should be concerned if they receive a utilization audit letter like this, because the auditor said they are going to monitor this psychotherapist every 3 months. Why? because they believe the psychotherapist is upcoding. That can easily be made into an allegation of fraud. The auditor is also telling the psychotherapist that they may report you to Blue Cross. While they don't say it explicitly, the auditor is implicitly warning this psychotherapist that they can audit psychotherapist, justified on the basis of a statistical sample, and then demand repayment, in this case, for $49,525. The risk of further auditing and a record request in a case like this is not conjecture. Several years of repayment can be demanded.